We are talking about booze. The SAQ is in the midst of a couple of pilot projects. One involves micro stores, mini stores going into places that are already licensed for liquor, like DEPs. So half a dozen of them in urban areas, basically designed to cater to people who either don't go regularly to their SAQ outlet, the normal liquor store, or because of, their scheduling, they need different alternatives because they buy booze at all odd hours. So those little mini SAQs are selling wines, which is not all that surprising. Grocery stores are also selling wine, depths too. Coolers, ditto, but alcohol as well. The hard stuff, yeah. And the SAQ is experimenting with delivery. About 150 SAQ products, delivery handled by couriers picking up orders directly from SAQ stores. And if that pilot project works, well, this is going to be expanded across Quebec. There are concerns about this, and we welcome from the Quebec Association of Public Health, Marianne Dessureault. She's a lawyer and a spokesperson for the Association of Public Health. Thanks for joining us on CJ 8800.
Thanks for the invite.
You've written about this, the association, some concerns that you have with these two pilot projects. What are those concerns?
There's some concerns about really for the young people specifically. The mini agencies aims to sell exclusive SAQ products in convenience stores and grocery in urban settings. But the science is telling that increasing access to wider variety of stronger alcoholic products and during extended hours, it's bound to increase the already well-documented negative effects of alcohol. And maybe there's not the same control as the real branch of FAQ and the convenience store and the DEP. So we are worried about the maybe younger people getting higher alcoholic product.
Is it just my misunderstanding, or I thought young people were increasingly turning their backs on alcohol and are drinking less? Do you fear that this will reverse that trend?
Probably. I cannot be sure, but the science behind all the alcoholic beverages studies are looking into that. So it's really direct. When you increase access, you increase the marketing, and it's really bound to increase the consumptions, but also change the habit. So yes, now the younger people are drinking less, and that's one of the arguments that the ad of the ACQ is telling. It's we want to recover the revenues lost by that trend. So yes, it's worrisome.
Concerning the delivery, do you believe that delivery services will not do a good job of carding? In other words, checking age, or the website will not do it where they order would not do a good job of verifying age.
Mm-hmm. Yes, it's one of the concerns, the main concern. We have examples, and we hope that all the licenses will take responsibilities and make sure that no minors will be able to buy some alcohol. But yes, there is concern because in some clicks you can check the credit card of one of the adults, and maybe it's only at the door, rapid delivery at the door, or and the DEP. There's a lot of consumers, and you don't have enough time, or the person, the cashier, is 14 years old, so they don't really know what age is the person in front of them. So yes, there's concern, and we're asking maybe to revise the project.
I think there's also the question of, is a delivery driver really going to say no standing on the doorstep if the door opens when they ring the doorbell and the person looks right on, well, are they really of age? Are they really going to say no? Would you expect a delivery driver to turn around, walk away and say no?
I hope they will. Sometimes there is some ID verifications, but when you're in front of the consumers, you have a big day in front of you. Maybe they won't check as much as when you are going in store. So, and in the DEP, it's the same thing. It's in the convenience stores or the groceries. It's not necessarily their fault, but we want to make sure that there's the training behind and the staff training required, and we won't be repeating the tragedy of Athéna Gervais in 2018.
It does seem to me that there are lots of we already have a lot of places to buy alcoholic beverages. There's a DEP on every corner. In some neighborhoods, you have a corner, there's 2 DEPs on it. I don't feel that we are underserved in terms of access to alcohol as it is. So
no, exactly. We understand that, and we need to respond to the needs of remote communities. In speaking of access of alcohol, it's really legitimate. But we are not underserved sectors in the Greater Montreal. In fact, some of the new service points are less than 10-minute walk from another SAQ branch, and even less from another convenience store or grocery.
Since you published your opinion piece in La Presse, any feedback indicating that the SAQ is listening or pushing back on your arguments?
They didn't ask any questions, but we sent our letter to the SAQ, and to be very transparent, they asked for a meeting. So we don't have the date yet, but we hope that the letter and our meeting will be successful.
Yeah, well, you can lobby them in person, I guess. It's at least they are willing to listen. I guess that's one positive thing you can say, right?
Exactly right. And we hope to open the dialogue with these public health organizations with this project. We're not all against it, but we need to adapt it to the reality. And we urge, one point, a rapid change to the ACQ missions so that it reflects the values of health and social responsibility that we are expecting, because just as the SQDC, sorry.
Marianne Dessureault, thank you very much for the interview. I appreciate it.
My pleasure. Have a good day.
Spokesperson for the Quebec Association of Public Health.